Hello, dear friends. This is Sofia Dorinskaya, President of the International Bureau for Human Rights in Mental Health and head of the Sofia Dorinskaya Center for Medical Information. Today, I want to tell you about, and for us to remember together, some very effective, safe, and inexpensive choleretic remedies. Choleretic remedies are needed to improve the flow of bile from the gallbladder and for conditions such as gallbladder atony and biliary dyskinesia. This is exactly the kind of liver failure we're talking about. Poor bile secretion. It affects overall digestion and the function of the pancreas, because the role of bile is to emulsify fats, which will then be digested in the gastrointestinal tract. In general, people who suffer from biliary dyskinesia are aware of it, and doctors prescribe them certain medications. But continuing, in fact, the series of videos about simple, effective, and safe remedies that solve various problems, which were used 20, 30, or even 40 years ago. That's what today's video is about. So, a very effective and safe choleretic remedy is sorbitol. This is a sweet-tasting substance that is prescribed to people with diabetes as a sugar substitute. But this sorbitol also has excellent choleretic properties. As I already mentioned, here you need to know one thing. Sorbitol should not be overdosed. If the dose of sorbitol is too high, it will actually cause bile to be released less effectively. But a tablespoon without a heap is exactly the dose of sorbitol that activates the bile ducts and improves bile secretion. That's the first thing. So if you or your child or your relative is prescribed choleretic tablets, there's also this very simple and inexpensive remedy, and most importantly, it's absolutely safe. The second procedure, which is called of the pro worked, used to be very common in medicine. And I remember, for example, in the pioneer camp during the health shift, children who, according to indications, those with that very biliary dyskinesia, needed to improve their health during the sanatorium shift, were given this procedure. So, it's not a highly specialized medical procedure. Nurses in the pioneer camp used to do it. This is called Tubage. What is Tubage? It's a procedure that's done in the morning. The person, without getting out of bed, lies on their right side, whereas our liver on the right side. They are given a glass of warm, non-carbonated mineral water. Well, any kind. I don't know, like Yesentuki, for example. So you let the gas out and warm it up a little. They give this mineral water and a tablespoon of sorbitol to the person. The person drinks this spoonful of sorbitol, washing it down with a glass of warm mineral water. And they put a pretty warm, really warm heating pad under his right side, on his right side. And for 40 minutes to an hour, the person lies on their right side, gently rocking a little. So they lie on their right side and sway a bit. So this is a gentle stimulation of the liver's excretory function of these bile ducts. This procedure can be done once a week or twice a week. The only thing I want to say is never use choleretic agents on your own. So, I want to remind both my fellow doctors and you, dear patients, about these remedies. Never use choleretic agents on your own for one simple reason. If you have stones in your gallbladder, choleretic agents can cause blockage of the gallbladder duct. And this is an acute situation, and an emergency surgery will be needed. That is, the use of choleretic agents, so to speak, is always recommended by a doctor. So always consult your doctor. But you should always know that there are very simple, effective, and safe remedies that help the excretory function of the liver and improve the functioning of the gastrointestinal tract. I hope I helped you with this information. I hope I reminded my colleagues about these simple procedures. Thank you, dear viewers. This was Sofia Dolinskaya on evidence-based medicine. All the best.